I'm thinking traditional medicine, like going to the medical doctor and getting help. So I used the wrong word. It's my error. That was funny. I'm like, wait, what is it? No, I say go homeopathic, natural first.
Yeah, first. Okay, we're on the
same. Then go to the doctor.
Okay, yeah.
Fun things. Hello everyone. I have a dear friend again with me today. Actually, she tried to visit us a while back.
Yeah. 2 weeks ago.
Didn't work out so great, but here we are. Jackie is with us, and she's going to share with us some of these amazing opportunities to get support if you have cancer or know somebody who's struggling with cancer, and also some tips on how to avoid getting cancer. So I'm super excited to have you here. Would you like to share a little bit more than what I did about you?
So yeah, I'll just tell them a little bit about my journey so that they know who they're speaking to, that I'm not just a random gal that you pulled off the street, and that, you know. So my journey actually started about 10 years ago. My mom is going to be a stage 3 lung cancer survivor. 10 years as of May 23rd, this week, next week.
Wow, fabulous.
She came into Arizona, where we live. And she started coughing up blood at my oldest high school graduation.
Holy cow.
And as a result of that, I helped navigate the cancer journey for her. You know, she was smoking 2 packs a day. So, you know, I knew what was coming. Unfortunately, back in 2005, I actually started my journey into the cancer world when I got a job in a local oncologist office, one of the most prestigious offices in the Valley. Wow. And I started learning all about chemotherapy and administering chemotherapy. So I was a chairside chemotherapy nurse, so I've been in the trenches and know what people go through. I've seen it, I've hugged them, I've held them, and I've given them strategies on how to get through that journey. So
quite an emotional experience outside.
It is.
I mean, obviously trauma for the individual going through it, but I would think that the families also have that spillover. Like, how do I support, how do I keep my life going?
It's really hard, it's very complex. I know I always used to tell cancer patients when I was chair-siding, you know, I would turn to the loved one and say, and you really need to make sure that you get support and that you take care of yourself, because unfortunately what I saw was they get so emotionally invested in this person, and they're working, well, not only top themselves out, many of them have actually died.
Oh wow.
Gotten cancer themselves, or health issues deteriorated that they had. So it's really the emotional toll, not only the financial toll. People don't realize how much it really does take out of people.
Yeah.
And I got to sit there and watch it and hold people, you know, going through that. And
so what are some of your strategies you use to keep yourself safe? Because if you're supporting these other people, I mean, you have to have a practice of your own that helps you navigate some of that.
Right. And you know what, quite honestly, while I was going through cancer, when I was a cancer nurse, hands-on chair side, I didn't really have that. They didn't teach that.
Wow.
No one in the cancer world or in the medical professional work with the professionals to help you put that boundary up, to help you learn about things that you can do on your own, or even sponsored days or things like that, to teach us as medical professionals, nurses, chair-siding this day in and day out. I can tell you, my husband said I totally changed as a person. He was able to see differences in me. I honestly didn't, but
yeah, I would think that, and maybe this kind of maybe explains too some of our doctors that we experience that don't have much of a bedside manner. Maybe that's their protective mechanism that happens in order to keep them safe.
It could be. I mean, there are some that I could see that, but then there are some that just aren't
bedside manner.
Well, you know, it's not even a bedside manner. I think if someone doesn't walk in your shoes, they don't know what it truly is. They're learning it from a textbook.
True that.
Or didactic. They're not learning it from experience. Like when I got valley fever, I sought out a pulmonologist that he himself had valley fever.
Oh wow. That's a good idea, yeah, from relation by experience.
You know, because then
like the way
when I told him that the medication that they were giving me was too much. And I said, I don't feel that I need this amount of medicine, because you have to remember, when they give you medications, especially when it's taken orally, they're giving you 2 to 3 times more than your body actually needs, because it breaks down in the stomach and they're concerned about absorption and all this other stuff.
Right.
So when they're giving so much, they're giving high doses of antibiotics. And I'm like, I wound up taking myself off, and I'm like, no, you guys are killing me with these antifungals. Like, I understand that we're trying to kill a purpose, but this is not the way I'm going to do it.
Interesting. I didn't even realize that there is like that kind of, I mean, I think a lot of us trust our doctors to a level that is important, but also maybe educating yourself a little bit more and being the advocate for you, which is one of the superpowers that you offer.
Right, and that's what I teach is, you know, we have to empower ourselves. We have to listen to our body. Nobody knows us better than us.
Right.
And we have to trust ourselves. And we have to have those talks with ourselves, and we have to be able to speak up, because if we don't speak up, we then have problems in our chakras and things like that we bury down deep. So it's really important.
Yes, very important.
And you know, just because the doctor has 12 years of medical school, we're not doubting his ability. We're just saying, you know what you're asking me to do in my body just isn't feeling like it's working.
Gotcha.
And that's kind of what I've done in teaching people, and also learning how to integrate. One thing I never knew was I was a conventionally trained nurse. I did everything medical. Wow. I never was open. And so my world changed when I started learning about 9 years ago, when I took a patient advocacy class. And that was kind of like, after my mom had her journey, she said to me while we were going through it, she goes, what do people do if they don't have someone like you?
Oh, wow.
And I was like, I'm going to open up
Light
a
bulb.
business. Light bulb. Yeah, I'm going to open up a business, kind of helping people navigate the way, giving them information to help educate you to make educated medical decisions.
Yeah.
Because who's educating you? No disrespect to physicians, but when you go to one doctor, he's going to tell you what he knows. But is that the most latest, up-to-date, greatest information?
Or even just the amount of exposure he's had. Maybe there's a doctor that's had more experience because of opportunity.
Right, exactly.
Has the same opportunity.
Right. Well, if you go and the thing is, if you go to like MD Anderson in Texas,
right,
they have it's a big institution. So like, if God forbid someone gets a sarcoma, I've got connections at MD Anderson and Stanford, because they have 2 of the leading in this country's leading sarcoma departments, and they've seen that's like a rare cancer. Like, so like for everyday regular kind of things, this is okay, but for rare things, you need to go outside the valley. You need to kind of look for the specialist, find the expert in the field. And so that's how I've always navigated my own health, my mother's health. I mean, my mother is alive today because we wound up at the top experts in the country. And she wound up with them. And instead of her having a full open surgical procedure like one doctor said he does, he didn't do the newer techniques. You know, there's different surgeries. And so she wound up doing a surgery where it was robotic, and so they didn't have to break her ribs and open things up and be really uncomfortable. So she was able to do her surgery, and she did what's called a surgical resection. So she never had a biopsy. They actually went in, chunked out the piece where the cancer was, pulled it out of her body. They did a frozen section on the table, and then they decided.
All over my head. I don't know about you guys, but it's
well, it's
frozen section. I'm sitting there going, oh my gosh.
So what happens is they bring out the skin, the tumors, the cells. They bring out the actual part of the body.
Okay.
And then they freeze it. And then they stain it, and then they put it under the microscope. They slice
Check
it
for more.
and then they look to see if it's cancer. And so, you know, I had spoken to the physician and said, okay, if that's the case, then what's the next step? And she's like, well, we'll remove the whole lobe. So then they continue to move the rest of my mom's lobe.
So they do it based on where they see the end of the cancer, and then just continue to chisel away until.
Right.
Wow, isn't that so much better than just losing an entire organ or taking out a whole entire part of the body, and then having to deal with the consequences of surgery?
Exactly. And so, you know, for her also, you know, there's a lot of controversy, but from my experience, and I didn't bring it today, and I should bring it, and next time I'll show it to you.
Great.
But if you have a tumor and it's totally encapsulated, think of an egg.
Okay.
Okay, everybody thinking of an egg, have an egg in your hand. Now take a needle, and you're going to stick that egg with the needle, and then
gonna
you're going
ooze
to pull
out.
out.
Yeah.
And then you're going to hold your egg, and your egg's going to be in your body, and stuff slowly seeps out of there.
Right.
Now, the problem is, a lot of times when we do a biopsy, is do we get the cancerous cells, number one, or number two, we don't get the cancerous cells, but we get a part, but now we've left an opening for things to come out.
Interesting. So you almost expose what originally was maybe contained in
Right.
other parts of the body.
So my
Wow.
recommendation is, from my experience, what I've seen is, if people have an option and people need to know how to ask, you know what, is there a way you can just cut this out completely and then figure out what it is? Because if it's bad, you're going to take it out, right? But now, if you've just left it inside of you, stuck it, it's had that time to disseminate and kind
Wow.
of ooze out and kind of make its
Wow.
way into your body. So then you're going about your life, right? And you don't think anything's wrong. And then all of a sudden, 7 to 10 years down the road, all of a sudden you wind up with another cancer diagnosis.
Interesting. So if they don't get diagnosed with cancer the first time that they do the biopsy, you're saying that if it wasn't detected in that test, you could actually be exposing the body to, just because it didn't show up on that test, it could still be cancerous?
Oh, absolutely. I mean, I know of someone
Wow.
who he had for 4 years. They saw something on his pancreas for 4 years. They
Wow.
went in and they kept testing, doing the biopsy. Year 1, it was negative. Year 2 was negative. Year 3 was negative. Year 4 came back, stage 4, metastatic pancreatic cancer.
And they've been testing that same area this whole time? Wow.
So it's just
That's
a matter
kind
of when
that's
they
kind of
go
shocking.
in. Yeah. Well,
I mean,
it just,
we just kind of have this belief system. I think as uneducated individuals in the medical industry, I think we have a belief system that they know what they're doing because they see it every day. But I think that there's a limit to what they see or what they experience based on each individual doctor. So it's really cool that you're bringing that to this group's attention.
Yeah, so there's lots of things, but the main thing is that people have to be empowered. They have to take their health into their hands. And so once I started going to my patient advocacy class, and my mom said that, what do people do? And I'm like, okay, let's make a business out of this. That's when my eyes opened up to natural and integrative health and healing.
Right.
And that's when I started doing some journaling to get emotions out. And that's when
my world.
Yeah.
We're actually looking at doing some stuff together, so I'm actually very excited. Sorry, I didn't pull on you. There is an opportunity for us to kind of work with, helping people recognize how to process emotion in a way that the body doesn't take ownership. So the part of the reason I'm super excited to have her here is because I want you guys to understand, by not taking ownership of the mind chatter and the belief systems that you stuff deep into the body, you end up literally digesting it a different way, and it can create intense trauma and experiences you really don't like. When we were talking, you had said you were able to track back, 7 years, did you say, to a traumatic experience to end up having cancer. And it's a pretty profound statement to have, to actually say that, say you go through a divorce or some traumatic experience, and 7 years later, you may have health issues. So it is important, I can't reiterate enough, it is important to process all the things that you're feeling and all the emotions so that your body doesn't take on the battle. And I think it's profound. I love that you say that, because I think it's so inevitably. I mean, I have met many clients who've dealt with cancer, or I had a girl who was dealing with ovarian cancer. It's not ovarian cancer. Ovarian cancer. And she had this belief that she couldn't have children. And when she just had that invested belief, a couple of years later from the first diagnosis that she couldn't have children to the actual cancer, it was 7 years. I actually looked it back, and I was laughing. I was like, not laughing at that, but laughing at how you were spot on. It was 7 years.
Yeah, and
That's
most
a
people
profound
don't
thing.
understand. I mean, I've sat and counseled, and I just open the door. What I am is a door opener.
Right.
I'm a seed planter. I help coach people if they're interested, because we don't realize today we actually hold the key to our health.
Yes.
And unfortunately, what we've been taught is that it's in the hands of a doctor, and we're our own healer. That's what I've learned. And what I try to do is help the person take back and
For the signs, look for the clues.
yeah,
follow the
and
trail.
think about cancer or any chronic disease. Okay, anything that you're struggling with. it's like the dashboard on the light of your car. If you equate yourself to a car, if that light is flaring, you're going to take care of it. Why aren't you taking care of yourself?
Yes, exactly.
Why are we not? And I have to say, I was the worst person. I was about another 100 pounds heavier. And I was not very kind to myself. I stuffed myself with emotions, all kinds of things. And it's been a process. This is not going to happen overnight.
No.
This is a journey. And you just have to decide, I'm tired of being sick and tired, and I want to get on this journey.
Yes.
And we'll help you.
Yes.
She can help with the emotional stuff. Definitely, that's out of my realm. I'll open the door because I like to journal. I like to do some meditation. I have my mala beads.
Absolutely.
I started wearing these now. It's my new thing, so that when I feel anxious or something, I start holding on to them and kind of like giving gratitude. And I'm trying to work on really being grateful for things, because I think if we bring more gratitude, more positive comes into our life.
Yeah, you're focusing on the positive instead of focusing on what's not working. Gratitude is the most powerful tool we have when it comes to internal chatter, because you can actually squash a lot of that negativity by just focusing on what is serving you,
right,
instead of talking about what isn't. You know, you have to acknowledge what isn't to recognize what does, but there is a balance there.
Right, and it's hard. I'm going to tell you, it's not easy, and I can certainly help you with cleaning up your environment. Most people don't realize all the chemicals we have in our environment, and what we don't realize is the cleaning products, the hand soaps, the shampoos we use on our hair, the makeup. You know, women are exposed to 168 chemicals before they walk out the door. You know, between shampoo, conditioner, mousses, gels, hairsprays, makeups, and everything.
Absolutely.
So, you know, I can help teach you. And cancer doesn't come, it comes from the emotions, but it also comes from our exposures. So what I try to do is help people understand that you have power to limit your exposures.
Yes.
And if I help educate you and introduce you to an app that can help look at how toxic the items that you're currently using are, you have a choice. And when you have a choice, that's really powerful.
It is. It does. It definitely gives you not only the wisdom, but the confidence in the product you're purchasing. I think it's just, you now know that you're okay, you're safe.
Right, and I think that's what I do, and I help clean out pantries and look at the food. I mean, and we just switch the choices and try to educate you. I mean, I remember years and years ago when I first started this business, I was blown away when I looked at Centrum vitamins. It's the most widely publicized vitamin on the market.
Yeah.
And I can't tell you the number of senior citizens that got angry at me when I was at health fairs trying to educate them. That product has shellac in it. It's on the label, shellac. And it's like, what would our body do with shellac? We don't realize.
What's the benefit to eating shellac?
Yeah.
Yeah, I think there's a lot of fillers and shelf life inhibitors that, you know, that are put out in our products to sustain quality, and it's not really, our body has no use for it, nor does it know what to do with it.
Right, and that's what happens is that, so the chemicals stay around lurking in our tissues.
Traces,
and especially if you're heavier, it loves fat tissue. And so it just kind of globs on, exactly. And so that's why, you know, there's so many things, and you know, we understand it's a journey, and I think that's where we both have similarities.
Yes.
We know it's a journey, and it's a hard journey.
Yeah.
And that's why we want to support people, right?
Yeah.
You know, because you need help to go through this.
Yeah. It can be intense. I think the most intimidating aspect about the C word is that nobody wants to have that experience.
Right.
And a lot of us equate to the C word meaning we're going in for surgery, or losing our hair, or we are having things taken away from us. And I think if you're proactive and you start really realizing what you're putting in your body or how you're interacting with your reality, you can actually create a more peaceful life in general, because I think a lot of our external products, I talk about it from an anxiety perspective, we don't realize how much that actually taxes the body and creates more anxiety in our experiences. Your emotional bandwidth is based on your physical as well. So if you're feeling exhausted, you don't have the normal emotional range to navigate stress.
Absolutely.
So there is a balance between it. So it's important to recognize, you know, if you're driving through the McDonald's, sorry McDonald's, but if you're driving through the McDonald's.
I used to do it all the time. I'm sorry. I was guilty.
The kitty Happy Meals on the way to the, you know, to the baseball. I'm like, oh shoot, I did that. I totally did that.
I mean, I did that. Not anymore. You know, my kids know I won't do it anymore because I realize. And you know, it's a process we don't always realize.
You have to acknowledge it.
And you know, we don't realize what we're doing to ourselves. And a lot of people think it's just their dumb luck. Like they had no responsibility or accountability why they got the big C, that it was just their genetic. Let me tell you, people, only 5 to 10% of cancers are really genetic.
Wow. 5 to 10%.
Most of it is actually environment induced.
It's kind of, that's hitting really home to me right now because I actually lost a grandmother to breast cancer, and my mother's mother, you know, very young. So I sit here and think about that. You know, you think about even back then environmentally, they were smoking cigarettes, and even if they didn't smoke it, they were exposed to it because it wasn't as contained as it is nowadays. There's just so much about our environment and our abilities to cope. It's fascinating to me. It's kind of hard to even think of anybody who's actually died of natural death, natural causes anymore. That used to be the norm.
Right, not anymore.
Now it's, you know, kind of...
It's usually due to something. And I can tell you most cancer patients do not die from their cancer.
Oh, interesting.
Most of them die from secondary effects that they receive from their treatment. It's either the cachexia, they've been wasting and losing weight. It's
cachexia, is that the term for
cachexia? Yeah, is for massive weight loss, because what happens is that the body is taking the food that they're eating and actually turning it into growing the cancer, and it's just overcoming them. So they have no energy, they're drained, and you know, or they wind up with a pneumonia. They, you know, or they
their immunity is just so
their
compromised.
Immune system is just so compromised. And you know, I used to tell patients the best shake to make for cancer, which was,
I love it, write it down.
which was milk, ice cream, bananas, and peanut butter.
Don't eat this thing.
Don't eat this, please. Not anymore. Now I tell patients, okay, let's get out our, you know, nut milk.
Yep.
And take some nut butter. And we don't do bananas. We'll do blueberries if you want. And we're not doing ice cream, and some ice. And that is it. And
I found bananas to be a great replacement for ice cream. I freeze my bananas. Is that what you do?
Oh yeah, frozen bananas.
And the actual, they say the blacker the better, which is really interesting, which is when they're really super sweet. And it actually helps fight illness in the body. So it's really things that you think, you know, you've been eating those bananas, you've been throwing them out when they turn black. Cut them up and throw them in the freezer. They're great for ice cream replacements.
Yeah, and the thing about it is that you want to, and we were talking about some tips. So here's a tip for you, okay? Take note. Get sugar out of your diet. As much as you can, get sugar. Sugar is the villain. Not only is sugar, but if you're one of those into Splendid and artificial sweeteners, really, those got to go too.
So what is your take on things like honey and maple syrup?
I'm okay with those in little quantities, small doses, You know, natural is always better, but you know, the white cane sugar is really not how sugar looks. So if you wanted sugar in the raw, you want to go for things as natural. I teach people with eating, try to go back to biblical days. When
Simple
God
foods.
told us, you know, what to eat, and he gave us the Garden of Eden, and he told us everything was there. So we go back, and if you think about it, medicine used to be from plants all the time. A lot of the first chemotherapy drugs are plant alkalines, and what happened was when pharmaceuticals came in, they took it and then they added synthetics, because to be a drug it has to be synthetic. It can't be natural to be a drug. So they evolved.
Amazing. What an amazing concept. What I just heard you say to me is that the whole point of the drug industry is it has to be a synthetic product. Is that what you're saying?
Yes, that it has to be.
I don't know why, but that's really hitting me shocking right now, because I've always made up this belief that it's plants that they've broken down and just like literally focused on an element of the plant, and that's why I always thought medicine was. So I'm getting an oh my gosh moment for me right now. I'm like, This is why I don't, because I really don't take medication. And it's a big
That's
thing
great.
for me. I'm big on, I really do believe sometimes physical pain is here to help us grow our ability to cope. And so I will, muscle through a headache by sleeping or meditating or doing something different before I would take anything.
Yeah.
So it is kind of interesting to me. If I get like aches and pains from working out, I'll eat more protein to offset the,
lactic acid
Thank
buildup.
you. The lactic acid built up in the muscle. So there are things that I do that I know that you can just do without taking. I know it's so much easier to take a pill. I get it. I totally get it.
Well,
But
yeah,
it's
we've
so much
unfortunately
more
been
fulfilling.
conditioned. We've been so conditioned for so many years, unfortunately.
Yeah.
And I'm not here to
Bash
anything. Not at all. It's just, I mean, I was there once upon a time.
Yeah.
And it's been a journey for me. It's 9 years. I'm still not skinny mini. I'm still not where I want to be. But, I know I didn't get this way overnight. And I'm not going to, it's been a journey. But if you saw pictures of me from 10, 15 years ago, you'd be like, oh my God, you don't even look like the same person. 9 years ago, there's a picture of me on my website and people look at that, they're like, that was you? I'm like, yeah, that was me, But I mean, that's just how it is. And it's just a process. And it's just a matter of us all getting on the journey and how we want to process it. And emotional wounds, stuffing them in, like you said, is really hard. And
what are your other options? I mean, I'm a big advocate. If you've exhausted everything, then you seek traditional medicine. That's just me, though. That's the way I live my life.
I would rather tell people, seek traditional medicine first.
Interesting.
You can always go back to the chemotherapies. You can always go back to the drugs and things like that if working on the natural stuff doesn't work.
Okay, we're saying the same thing, but we're using different words. I'm thinking traditional medicine, like going to the medical doctor and getting help. So I used the wrong word. It's my error. That was funny. I'm like, wait, what is it? No, I say go homeopathic, natural first.
Okay, we're
then
on the
go
same.
to the doctor.
Okay, yeah. I usually go to the chiropractor first.
We're saying the same thing.
So, because it's like, we need to try those first because, and you know what, quite honestly, when my kids were growing up, I was so not like that.
Yeah.
We had really good medical insurance, and I'll never forget my mother-in-law. She was so cute. She told me to warm up olive oil. And my kids had chronic ear infections, and to drop olive oil, I'm like,
in the ear,
I'm like, are you crazy? Like, I thought
that's my food. What
I'm
about
like,
food in my ear?
I'm like, okay, I don't think so. But when they grew up, when my husband grew up, his family was not affluent, and they didn't go to the doctor a lot. She didn't believe in going to the doctor a lot, and unfortunately, I really should have kind of learned a little bit more from her when she was living before the Alzheimer's kicked in for her.
Yeah.
Because for me, my family, unfortunately, I have a brother 2 years younger than me who suffered a grand mal seizure at the age of 2. And so my whole life, when I grew up, we were always in a hospital.
Wow.
We were in a hospital, in a doctor's office, so we were very, what I would say, very conventional, medicine. So that's what I grew up and saw. It's like, okay, you have something wrong with you, you go right to the doctor.
Yeah.
And I was constantly, my kids, I can't even begin to tell you the number of antibiotics they were on because of ear infections and things like that. And a lot of times if your kids are getting ear infections, it's what they're eating. It's taking away the dairy. It's taking away the gluten. It's looking at the foods. And I'll never forget, I came home one point because my poor middle guy, Jacob, he was he just graduated from college, but when he was really little, he had really bad asthma. We lived in Maryland. And I remember going to the library and they did all this allergy testing. I had to hold him down and he's screaming and I'm like, oh my God. It was awful. It was very traumatic, very traumatic. And I just remember going to this library and I found this book and it said, it was by this woman, Doris Rapp. She's still alive. She lives in Scottsdale. She's a big environmental pediatrician. And is this your child? And it talks about all these different things like learning disabilities and things like that. And you read the book and it tells you how to do an elimination diet. And when I came home and told my husband about it, that I was going to try it, he's like, what are you, crazy? Like, what are they going to eat if you're taking everything out of their diet, Oh
my gosh, if my kids are watching this, they're going to be like laughing because we did the elimination diet. That's how I helped my kids. My the teachers were saying my children were dealing with, they kept on saying, oh, they're ADD. I'm like, they're not ADD. I knew it wasn't. So I took everything out of the diet and we did the whole Brett's diet and in combination. Was it the Brett's diet? No, that's the
bananas. That's for
stomach flu.
But I know what you're talking about.
It's just really, really basic, like basically
basic food,
super simple, like baby food that you would take, introducing in the beginning of life. And it was amazing how much I learned about each individual personalities and their, like what foods affected each child differently. It was really fascinating. I mean, I think everyone should go through it because you learn something about yourself.
And I think when we're new moms, and I would love to reach out, hopefully there's some new moms listening, because we don't realize, nobody educates us. Nobody teaches us. And, as a new mom, I was giving my kid the foods like the doctor said, but, I didn't realize pears was causing him, like, so much diarrhea. Like,
yes, the sugar
I was like, wow, that's great, because then he'd have a poop. So it's like anytime he got backed up, we gave him pears, not realizing, the implication, because nobody really sat and explained it. Yes. When you're a new mom, there's so much going on, and a lot of you are probably, I don't know about you, but I really had postpartum depression. I really struggled every day just to have enough energy to get through the day. And it was hard. It was really intense. And, what your body goes through, and then on top of which...
sleepless nights because of newborn.
Exactly. Yeah. And you're exhausted. And then next thing I know, I found myself pregnant again. And because my younger two are like 14 months apart, and it was like, oh my God. I just remember going through those times and just like, oh my God, are we almost over? Are we there yet? Are we there yet? It's like, okay.
The things we do to ourselves.
Yeah, and now I look back and 21, 22, and 27. It's like, where did those years go?
No doubt. Don't they disappear fast?
They do, really fast. And nobody taught us to be more alert. So that was another tip.
Yes, and to follow your intuition.
Yeah.
I feel like a lot of the things I minimized when I was a new mom was that it just didn't feel right. I mean, out of convenience and ease, a lot of the times you would buy the same foods all the other moms are doing because you're kind of mimicking the behavior.
Right.
And I remember I used to have, they had this pacifier type thing where you could put a fruit in the pacifier and they'd suck on it until and I used to have friends that were like, that's gross. And I'm like, why is it gross? It's like good food. They're not choking on it. It's safe, you know? So we succumb, I think, sometimes to peer pressure and environmental, experiences. And to trust your instincts. Like, if that resonates with you to do it, then I think you should do stuff like that, know? And seek advice that makes sense from people you trust instead of just deflecting.
Well, I think that's a big thing, and I think as new moms, we're not. We've never been down that road, and we're not quite sure. And I know for me, when I became a new mom, my big thing was both my mother and my mother-in-law didn't breastfeed, and I was living in the Midwest at the time, and let alone not even thinking about a natural birth. I mean, I had as natural as can be. I had a C-section. Yeah.
That's painful.
Yeah, it was extremely painful, trust me. It was not happy. But I decided to try to breastfeed. I was around people, Midwest, it was very big back then, 27 years ago, and they were introducing it, and I was like, wow, this is not so bad,
Yeah, it's actually a great bonding experience.
Yeah, it was great. It was great. I breastfed all three of my kids. My first one was 6 months until he started thinking it was fun to bite me, and I was like, I'm not doing this. I'm not,
I'm not your teething ring.
I'm not your teething ring, my middle guy, who was 4 months, what I realized, he had allergies really young, and that was a real struggle for me. Because usually breastfeeding babies don't vomit. Yeah. So he was projectile vomiting. So he was, whatever I was eating was going into him. So eventually I found out that I wasn't eating much and I was exhausted even more. So I was like, we have to switch things.
Interesting.
And then just beware of those formulas and what you're doing, because I didn't know. And 22 years ago, 23 years ago, we wound up putting them on soy formula because the milk formulas didn't agree. So they said
allergies back then, if I remember correctly, because they thought there was a milk intolerance.
Right.
They shifted them to soy. There's a lot of babies who went that route.
Right. And the problem is
goat milk.
The problem is that the soy now caused him to have a thyroid issue.
I was gonna say,
it killed both my younger two kids with their thyroid. So just live and learn. That's all I can do is impart wisdom to you. And,
it's really an interesting experience. I think that we don't realize, sometimes, like in that situation specifically, we're in survival mode. A lot of the times we trust the support system around us at the time. And you can definitely create a lot of story of shame with her children being sick now. And I just want to address to that, not just that you need that, but I think you already made peace with it.
Yeah.
It's like you you do the best you can with what you know at the time.
Right.
And we can always look back and go, oh man, I totally messed that up. Or I totally, could have done something different. We only know what we know, and that's why she is so important. If you're going through any kind of emotion, like a
medical
trauma,
any kind of medical,
and you need support, you want clarity, please reach out to her, because I think she's not only an amazing plethora of knowledge around the medical industry, but she has that compassion between the balance of both. She has just that beautiful wisdom about what's being done in the hospitals and how it could be done in a way that supports you more naturally and help you kind of shift some of that perspective. So I'm super grateful you're here, and I'm so honored that you took this path. So
it's just amazing.
It's just great.
And just meeting great people like you, because I know for me, when I started working with people, and I sit there with a breast cancer woman or someone, and I'm like, what happened to you 7 to 10 years ago?
Yeah.
Something really emotional triggered this. And 9 times out of 10, they start crying, because I said, if you don't feel like you have to share it, you don't have to share it with me if you don't want to. I mean, but even if you do share it with me, I'm not qualified really to do much about it other than introduce you to Louise Hayes, who I love.
Amazing.
We do a lot of, I introduce journaling with that, do some meditation.
Morning pages. Y'all know how big I am on morning pages.
Yeah.
Purge those thoughts.
Yeah.
Let them go.
And then the other one is this guy, Eli Bay, who teaches them deep diaphragmatic breathing, and so it's just more than that. My toolbox is a little bit empty, so because I'm working on my emotional self as well, so this is great. And when I met Tamra, I'm like, oh my god, yeah, very cool. You can be my emotional person.
Help each other. So it's going to be a lot of fun. So I'm definitely going to ask you to come back and do another visit with us, and share. Maybe we'll go more specific into different types of like things and tools that people can assess and change in their house to help kind of eradicate. Maybe we can even bring products or something, and we'll figure something out for everyone to make it fun.
Okay.
But I really do think that it's important that you guys reach out to her if you're dealing with anything specific and that you want support around immediately. And so grateful you're here. So thank you so much. How can they get a hold of you?
So you can get a hold of me. You can either call my cell phone, 602-465-2733, or you can reach out to my website. It's patientadvocatesaz.com, and I have an info sheet, and you can just fill it out and send it over that way. And
I'll tag that down here below for you guys. You can definitely get a hold of that.
I got to rework my website, because right now it just really focuses on patient advocacy, but my passion is helping people and being a health coach. I'm a certified cancer coach through the Professional Cancer Coaches International, and so I'm one of 12 coaches that was selected, part of the United States, through the Cancer Coaches of America. So my passion is cancer, because so many people feel like they don't have any options and that this is their only choice. And I just want to say, you have a lot of choices. You have a lot of options. You just have to look outside the box.
Yeah, and where to go, where to find the information.
And who's credible. A lot of people put information out there, and it's kind of scary what goes out there. And so you just need to know that you're making educated decisions, and that you know what it is that you're looking at. I mean, I've got a beautiful cancer guy. 19 years ago, he was diagnosed with prostate cancer. And 16 years ago, his PSA number jumped. And so they did a biopsy. They said it was negative, and he's like, he came to me, and we had a whole discussion, and I said, you can always go back to radiation. You can always go back to chemotherapy. It's a lot harder to do those things first and then integrate natural stuff. Right. But let's see if the natural stuff helps. And thankfully, knock wood, he's been 3 years, and in 3 months, the spot that they saw went half, 50%. In 6 months, it was gone.
Interesting.
And he's kept it gone for the last 2 years, and he changed his diet, and I give him credit. I mean, I think men are a little bit easier than us women. He was very diligent. Anything I told him to do, he actually did. And the last part was the emotional, because he's a little bit high strung, and we've been working on that emotional piece with him. And he actually, a couple months ago, really got into his religion and started studying.
Beautiful.
And really sucking that in, and I really see a change on him. And
Great.
it's been wonderful. So, you know, you have to find your passion. What is it that you're passionate about? What is it that's going to light you up? And then, you know, seek out.
Absolutely. Well, thank you so much for being here and joining me. And,
great.
If you guys want to re-see this, I will be posting it up on YouTube. So go ahead and go to my YouTube channel, sign up there for this and many other episodes. Talk to you guys soon.
Yay!
Bye.